I hope you guys are not tired of me yet. Now what happens is, when I used to come before, I would just say the things I just said about my parents, and now I left this place and went ashore and saw other places. But now later on I discovered that if I'm telling the people all over the country about sickle cell disease, why should the people in my own town don't know about it? So I added this part of it. So I'm happy to present this in a quick form. You are all students. You are not sickle cell children, but there may be some children who have sickle cell disease in your family. So we want to tell you about it. We want you to encourage them. We want you not to stigmatize them. We want you to love them and give them. We want you to understand their problem. And teachers, please, that's why we are doing this today. This is an awareness section of my talk. Know your genotype. It's a simple thing. It's the cheapest way to help yourself. A must to reduce the scourge of sickle cell disease in Nigeria. And that is the 15th award. Now, everyday life experiences. Symbolic master our experiences you will find out that I will talk for the next 1 hour. Just these experiences. Oríṣiríṣi ló ń ṣẹlẹ̀ ní family wa in those days. Táàmù, they will say, oh, àbíkú ni, bí ó máa ń kú tọmọ tiẹ̀. Ọmọ tó dá ló ń bí, ojú ẹ̀ ń pupa, kìíní kan. This is what is happening. You have a man who will say yes and goes to marry another AS. Wọ́n máa bímọ, àwọn ọmọ á máa kú. Ọmọ yẹn dẹ̀ ń kú is because the earth continues to combine. Gbogbo nǹkan tá a jẹ́ both in our head, our eyes, our legs are made up of 2 genes. Each one is a pair of genes from your father and from your mother. So tẹ́ ọ bá bímọ kan tó ṣe, bàbá ẹ̀ ní máa gbọ́mọ yìí lọ ìwọ̀n àwọn onírú ẹ̀ lè tàwọn ìwọ ló wọn bí tó ti gbé wá. That is not true. Because they are taking some genes from the father and from the mother. This is a professor, eléyìí sìn. He had 4 big boys. 3 boys and 1 girl. Ọ̀rẹ́ wa tiẹ̀ ni wọ́n. Head of the whole ní ìyàwó teacher. The 3 boys died one after the other at the University of Ibadan. Because when they get to a point of stress, it could be a dangerous point. So the boys get died. On the short term, I couldn't go to their house because one man might go to tell them nothing. So polygamous homes, you have different wives, you have different genotypes, and if they don't know, and the children are different, and everybody is worried. Next slide. I'm just telling you that Nigeria holds the #1 position in the world about the problem and burden of sickle cell disease worldwide. The whole world, globally, we are #1. We carry 1/3 of the problem of the whole world. Of the problem, not only the number is the highest. The type of sickle cell disease is the highest, because I can't do the science here today. It's too much here. And in that family of sickle cell disease, it's a family, not just one type, but there is one type that is the worst. Abalakari is the worst. So when we come out there, we find that there are so many. We are in the red, and you can see the red part where Nigeria is sitting. The other places, even there, they still have some other genes that help them. Genes that were studying, that is my area of genetics. We found that is the worst part of the genes that surround them. So it's not helping the sickle cell gene, and there they are with the problem. So we have the highest number. Next slide. Look at this. What is genotype? It's determined by the type of genes you take from your father and your mother. Not only mother, not only father. The two come together and make the gene for your body. Before you produce a child, the genes have come together. And what you find is, when the genes are made up in Nigeria, you find AA, AS, SS, AC, SC, and so on. There are many more. 141 changes here. I cannot list them. But those ones are very minor. They are very few, and they don't do any harm. That is why I put the S as being the most dangerous, and that's why it's in red. And that red means a law. You need to see the lifestyle of A and SS. Some of them are luckier than the others because there are some other interacting genes that help them. But some are not so lucky. I cannot go into the details today, but I'm telling you, somebody with SS has to work very hard to take care of herself or himself and be able to live well. But when you talk of blood group, Blood group is the surrounding things, genes in the outside the skin. It's like something is on your skin. You can look at that separate, but if you cut that skin, you get inside the blood. So inside the blood itself, inside the cells of the blood, that is where you will find the genes for genotype. Outside the blood cells, you will find the blood group. So the reason why you do blood group is if you have an accident or you are having a baby, they need to titrate your blood and know your own type of blood to give another person or to give your baby. So you cannot give something that is different to the baby, because inside the mother there is a reaction. So you have to be very cautious when you are giving that mother some blood. The blood of the mother, you have to look at what is in there. So that is why we do the blood group. The blood group is in different types. You can have blood group A, B, O, and so on. O is the commonest, but O positive, O negative, all these things they will check. But don't then go when they say what is genotype and go and say I'm A. You go there and say I'm A. A is blood group. If you are talking of the genotype, you can be AA. So please let us know the difference, because many people, they've caused problems in their family. The husband will say, oh, I'm A. Wàhálà ẹ ti pọ̀ jù, kí ló fẹ́ máa lọ check. And then the woman is already S. And then they marry. The first son comes, second, third sons. Everybody is SS. And she starts crying. My husband said this. Please do a proper check and be sure of what you have. So we find that, sorry, this is not going, pictures are always better, but anyway, we find that when children are born, by the age of 6 months, the blood that is going to live with for the rest of his life is formed. When the baby is being born, the baby blood comes from the baby inside the womb, and that's the blood the baby comes out with. But as the baby gets to 6 months, the blood that is going to live with throughout his life takes over, and that blood is whether you become 102 years old, that is the blood you will now be living with. So what we find is that baby is born, it's still okay, but by the time he's 6 months, he will start having swollen legs, ankles, red eyes, and so on. Blood is getting low, we are carrying the baby to hospital and so on, and that continues. That is sickle cell disease. But if it's a normal child, by the time he's 6 months, the adult hemoglobin is going to have, whether it's AA or AS, is formed in the baby, and the baby is fine. What are we trying to do here? We are doing awareness and prevention of the burden of sickle cell disease in Nigeria. So kí gbogbo wa mọ̀ nípa sickle cell disease, how to look at it before we go into marriage. But I'm not saying you guys to go and wait till you want to marry. It's wrong time. By now in secondary school, it should be in the curriculum. We have been telling the government it should be in the curriculum in primary, secondary, tertiary. So you already learn about it, you already know what you want, and then you make an informed decision. That is only so I won't be able to go with SS, so let me not marry AS because I know I'm already AS. That's all we need you to do. And if you can cope with SS children, you go ahead and marry. Nobody can force you. But don't say nobody told you. Now you are knowing there is something called AS, there's something called SS. Make up your mind, know what you want to do. Drag the boyfriend there and get tested and know your genotype. So look at the distribution. But people get it wrong. They will say 1 in 4. It is not 1 in 4 like that. See here, there is no SS because only A and S will combine. Look at over there, the same thing. Next one. Look at this. This is all the organs of the body that this sickle cell affects, because every drop of blood in your body goes to all these places, to your brain, to your eyes. The brain tells the blood where to go next, the kidney is filtering, the heart is beating. Every drop goes through all these parts of the body. So when the blood is now SS, like over there, it gets to these tiny places, it cannot pass. Then the arms, the ankles become, the hands become swollen. It gets to these little places, it gets stuck. It's like bringing water from Aurora, big pipes, and then you get to this classroom. It's going to be tiny pipe. It cannot pass again if there is dirt inside it. So when the blood is having those cells, they clump together and they cannot pass. And because of that, there is stasis. It will start breaking down. Instead of 120 days, this blood will break down to 50 days. How can 50 manage 102? So it keeps producing more, trying to produce more. The child is getting tired, he's lethargic, he cannot do what he should do. The blood is very low, he cannot run, he cannot. This is the reason, because the blood circulation is hampered and the amount of blood there is lower because it's breaking down every 50 days. So next slide. See, these are early symptoms of sickle cell disease, hand foot syndrome. In the adolescents, we have some of them, about 10% of them, not all of them, have these humongous ulcers tí ò ní heal. Àṣeṣeṣe wọ́n ní heal. Ìgbà míì we get some to heal with new techniques, but that's not even available in our usage because they cannot pay for it. So when we do our research, we bring it in, we try it, and we see it works, but we cannot afford it too. The money will finish. Then look, all their sternum and their displays everywhere. Many of them you see working like that because of this problem here. And then you see the eyes. Next slide. So what we are doing today is awareness and prevention, education. We can do genotype screening to do prevention. We can do neonatal screening. That is when you have a child, before that child is discharged from the hospital, we should know the genotype of that child so that you know where to take the child. Ẹ má sọ pé ẹnìkan tó wà lẹ́gbẹ̀ẹ́ ló ń jẹ́ kọ́mọ mi gbóná. There is nothing like that. So neonatal screening is immediately the child is born. The first few days of the birth, they will test the blood and they will tell you this is SS or AS or whatever, and then you can take it to the doctor and they will register that child and take good care. So the symptoms that come after, they will already be taking care of it for you. They give them penicillin and all that, so the child will not be as bad as it used to be. So bone marrow transplantation. In bone marrow transplantation, that is the high end of science. You wipe all the bone, all the marrow inside the bone, one wipe it down, one day if you want see. But before they can get that, they have to screen the whole family. They have to be sure they get the right one. And as I told you, it's not every child that has the same genes, even from the same parents, because you can take a gene for tall from your daddy and the gene for short from your mom, and the other person takes the TT of the father. If the father is T, big T and small T, one child can take the small T of the father and take the small T of the mother, kokuru, and the other one takes the big T, which is dominant, and becomes taller than the other one. So there are, every gene in the body has an origin, and it is what you get. So one wipe everything out. All the genes that make sickle cell, they wipe it out and then they put another one that makes A. But it's not an easy one. How many will you screen out of millions of people with SS in Nigeria? Owoda is a very expensive procedure. So then there is gene transplantation. And when you were experimental in America and other places. So the least expensive one is what we are doing today. Awareness. Find a correct place to do your genotype. I used to come and do it here before, but the thing now we do is we use a more sophisticated type. Each one is about 7,000 naira, and it's difficult for me to even be carrying come and do that. We do it, and in 10 minutes you get your result. It is called point of care test. That's what we do in my lab in Ibadan, and we try to do that to other places, but we cannot carry it here today. So this is what you need. Now look at this. This is what sickle cell is doing to reduce sickle cell disease in Nigeria. These are our strategies. We have prevention, which we are trying to do today, awareness and prevention. We have care. You needed to see me last week with these children and the adults. You will love it. We care for them. Sometimes we buy some equipment like a grinding machine. So we give them a lot of things that they can use to be productive and not stay there unhappy. So we care for them, we refer them to doctors, we also try to give them talks, counseling, everything. Come stigmatize one. Many of the children get discouraged. Even nílé wọn ayọ̀ gbálẹ̀ tí wọ́n máa nà wọ́n. Ipe kí náà ṣe yàtọ̀ sáwọn yòókù because they don't understand. So these are the things we do. We get the society together, we talk to them, care for these people, don't stigmatize them. Then we do a lot of research. I think research has been in my pocket for the last 50 years. My lab is still running, and I want to thank that Mr. Tunde. I don't know where he is. He's the champion of my laboratory for the last maybe 30 years or more. That man there, that big man there, he's as big as that in the laboratory. He heads all the laboratory for me in the UCA. Thank you very much, Mr. Adeyinka. Please give him a hand. Now, advocacy, that means you are talking to government. I am talking to them every day. They say yes, ma'am. When they come, they say we do it. They are not doing it, and I've told them they must put this in the curriculum. They must give things to the primary healthcare center. They must work in the underground to make sure that people go to hospitals and get something to take care of themselves. That is our advocacy. But curriculum yẹn ló jà wá lógún, and the Ministry of Information they would come and we beg them pé your jingles must not be cost effective. Lè máa ní ká sanwó fún jingles nígbà tó jẹ́ pé nǹkan tá a fẹ́ sọ is about children, about Nigeria, but wọ́n á ní kó wá sanwó kó tó lè sọ̀rọ̀. So advocacy continues, and any of you can have advocacy. If you know any of the media, they can help us to make it public that sickle cell disease in Nigeria is something. Láti any agbole, any village, it is there. Before you look around in your family, I don't have any in my family, immediate family, but I know when I look around, I remember that my father's sister, the firstborn of their family, had 6 children. And when méjì to them, one of them had this severe leg ulcer. We didn't know then. I was a small girl. But later on, when I thought about it, the other 2 out of the 6 that first died were the ones with sickle cell disease. Even their children are living elsewhere. So we talk about it. So these are the things we do in sickle cell. And this is us in Ibadan. You need to come one of these days and come and see what we are doing. These are corpers being trained regularly to go into the community, to go into wherever they are located, to go and teach about sickle cell disease so that people can prevent this disease in Nigeria. That's where we are. On July 19 is World Sickle Cell Day, and we are there somewhere. In September, Sickle Cell Month, we are there somewhere. On December, we do gifting. January, we do gifting, and we help them, we talk to them. We make them happy, we make them understand why they have the disease, and their parents are always coming with them. Next slide. Finally, I think this thing has gone. Look at what I'm talking about. Look at those severe ulcers. That is a child in school. Look at the legs. That's the effect of sickle cell disease. Those who have leg ulcers, it's a terrible one. They have nowhere to put their shoes, and they are students. So you just empathize at what is happening to them. It is more imagined than seen. When we are treating these things with my surgeon doctors, it's a pathetic one. They are removing the bandage every week, and we have to use a special compression therapy, which is not even available in the UCA. We spend a lot of money, but the agony that comes with these people. There was a man, he was selling motor parts. One day we interviewed him, he was crying. This is a 40-something-year-old man. He was just weeping. He said when he gets to the place where he's selling the motor parts, all his friends will go away. All his other colleagues, they will say, oh, someone. Because this leg sore is not easy. It oozes out and is smelly. So these are the things we are trying to prevent by telling you about this disease. But we thank God that we are trying to explain to people, if you don't want this in your family, try and do a prevention approach. These are the professors that help us, doctors that help us. I am not Dr. Alabere, I'm Dr. Oniwe, Professor Oniwe, but my work is in medicine. So we work with them, and they are the ones. This is a notable surgeon. He does all the cleaning for us. He's an orthopedic surgeon. Next slide. These are the people in my lab. This lady came to Efalayi during the second gifting, 19 whatever. She's an Igbo girl. She was vice chancellor, Chrisland University as of this last year. When I was away, I traveled. She came to talk. That's Professor Babalola, and these are the people in the laboratory, and this is me. This was for Paris for L'Oreal UNESCO preparation. So that is the scientist there. That's what I do all day, looking at blood and finding out what is in there. Next slide. So what we are doing today is to prevent inherited blood disorders in Nigeria, and it's very easy to diagnose. It's a 10-minute thing. We will do it for you, and we will take very little money, like 7,000 naira, with the new method. The other method is like 500 naira, I don't know, but it's not very correct. There's a lot of misdiagnosis. So this is controllable by choice. By your choice, you can control sickle cell disease in your family as you grow up. Next slide. Next slide. So, be the vehicle of change. You are students, you are going places. Know your genotype. Join the KYG club. You'll see some of my people wear KYG. Please stand up, KYG man. This is our shirt that we wear in Ibadan. That's KYG, that is know your genotype. We wear this anywhere we are going, and we make sure that people understand what we are trying to do. So we make informed decisions, and we reduce stigma. There is a lot of stigma. Mama ni ọmọ tí ò dá ló ń bí is a mother's fault, but it's not. Go out there and influence your community. That's my message for you. Next slide. So you have a face and you have a voice. When you live here now, you can talk to other people. So you have a voice to speak. Broaden the knowledge of other people. Talk about it. Read about it. Don't go to the internet to read Yahoo. Go and read something useful. Just say sickle cell disease. But what they will teach you is enough for a year's curriculum. Be proactive about prevention. Support the care of people living with sickle cell disease. Shame stigmatization and volunteer to support us. Next slide. So, who made us different? I always ask myself, who made me different? It is the grace of God. And that's what Matthew 25 to 37 says. Who made me different? It's only by his grace that I am what I am. So if you are somebody God has made whole, try and do something with the knowledge you have in your head. Try and go out there and do something worthwhile. That God gave you a life, and that life means a lot. When I was sick, when I was naked, when I was hungry, when I was in prison, be the good Samaritan. Go out there. People will be saying, Mrs. Falusi, but the point is, I'm not looking for 10 houses. I only have one in Ibadan. I live with my husband and my children, and I'm happy because I don't need 10 houses. I don't want to build any house for any child. That child should go and work like I worked and build his own house. And thank God, by the grace of God, they can build their own houses now already. So I cannot be building house to wait for somebody. So those of you will say, you are wasting your time, because people are going to just buy the house and throw it away in your lifetime. Once you have empowered them, they go out there, they will shine for the Lord. Wherever they go, in the world, they will shine and make your name known everywhere. I don't want to talk about mine, but God is doing wonders in my life, because the children I raised, I told them about my background, and I told them, ọmọ kan tí mo bí kò ní tajà ní Sábó, and none of them is tajà ní Sábó. So it is good that we tell them from the youth. One day that people won't listen, and then they will go out there and do exploits for you. So I want to thank you, and I want to say, if you have questions, when I get to Ibadan, my number will be Mr. Oweye. Call me. Any question you have about sickle cell disease, I will explain and lecture you on it. Thank you very much, and God bless.
Please, once again, say thank you, mommy. About the two facts, celebrate one another. About the celebrate one. Yes, mommy. If you have questions, let's pick just one or two questions from our teacher, parents, and our students. Sit down. Question. Okay, come. Another person. Thank you. How do we know that SCD is affecting the brain and the symptoms that we see is affecting another person?
How is it affecting?
How is it affecting the brain and the symptoms that you can see?
Okay, thank you.
Okay, thank you.
Now we are doing them together. Come on, we stand. Well, you know that the brain controls the whole body. That's it. So when you have sickle cell disease, the blood cannot move very well in circulation to the brain. So you may be having a headache. You may be feeling so tired because the blood has not gone to the lungs to carry the oxygen. You all know the functions of the blood. If I start calling you now, we waste time. There are functions of the blood. It carries oxygen from the brain, from the lungs to the brain and to your hands. If there is no good blood in your hands, you can't do it well. And that's why people will just go, have a stroke and go away, because the things they are not going to the right places. So if this thing is in your brain, if the cells are not doing well, it will report in your brain, and your brain will say your hands cannot do well, it's tired, and your legs cannot move fast, and you are consistently tired. You may not even feel like eating because the muscles of your body are not working well, and then your kidney is tired. You cannot filter out the waste products. All those things the blood does. You cannot do it because this brain has not been able to signal properly that there is something wrong. So you have to go and take care of that. Thank you.
ẹ jẹ́ kí sáré fi ìròyìn ayọ̀ yìí tó yín létí kí n tó kúrò lórí ètò ìfáínálì lénìí. Ilé tuntun kan tí wọ́n ṣẹ̀ kọ́ parí nílànà ìgbàlódé ó wà fún títà nílùú Adó Èkìtì. Remi Johnson Estate ó wà nífẹ̀gbẹ́kẹ̀gbẹ́ Pastoria lọ́nà Ìkẹrẹ́ nílùú Adó Èkìtì. Wọ́n ti kọ́ ilé yìí parí nílànà tìgbàlódé. Gbogbo nǹkan pátápátá tó jẹ́ tìgbàlódé tó yẹ kó wà nù ilé ló wà nù ilé náà. Mini duplex ní pẹ̀lú yàrá mẹ́rin àti extension room and parlour self-con lọ́wọ́ ẹ̀yìn nínú compound tó dáa. Gbogbo àwọn nǹkan mèremère ìgbàlódé tó yẹ kó wà nù ilé fully furnished ni, tó kàn jẹ́ wípé kẹ́ẹ̀kan moving yàtọ̀ sí àga àti àwọn aṣọ pẹ̀lú bẹ́ẹ̀dì yín nìkan tẹ́ ẹ máa kó wọlé. Wọ́n kọ́ ilé yìí fún gbígbé àti fún commercial. Ẹ lè máa fi ṣe service apartment tàbí hòtẹ́ẹ̀lì tàbí hospital tàbí ohunkóhun tẹ́ ẹ bá fẹ́ lò fún, ẹ tún lè gbé. Eléyìí tẹ́ fi máa ń kó owó fáwọn èèyàn wípé kán bá yín kọ́lé tó sì jẹ́ pé wọ́n máa lù yín jìbìtì. Ready made nílé yìí wọ́n ti kọ́ síbẹ̀ ní àyíká tó dáa. Fún àlàyé lẹ́kùnrẹ́rẹ́ lórí ọ̀rọ̀ ilé yìí tẹ́ ẹ bá nífẹ̀ẹ́ láti rà 0703 105 1831 nọ́mbà tẹ́ ẹ pè sí nìyẹn 070 3105 1831 tàbí 081 34 111 375 081 34 111 375.
Olúọmọ la fẹ́ máa gbọ́.
Olúọmọ Federation.